everybody, welcome to my talk today. Which post-registration nursing course should I choose? And I'm asked this by so many registered nurses and even newly registered or students that have an idea of the career plan and goals for the future. And however, if you've got no idea, do not worry at all. You might have had enough doing your degree and or your masters to register, and you might want a break for a year or two, which is absolutely fine, and you might come back to this talk later. There's so many different courses and modules to choose from, and I'm just going to give you 3 key tips in this short talk today to help you decide which post-registration nursing course you should choose. If you find the talk helpful, do press the like button and do subscribe if you want any more videos like this in the future. It's free to subscribe to my channel. So my first tip: how am I going to fund this module or course? When applying for any course or module, it is very expensive for academically accredited university courses nowadays. And so it's less likely that you're going to be able to afford to self-fund. And you usually will look at trying to secure some funding through your line manager initially, because they'll have an NHS budget if you're working in the NHS, or you look at securing funding through charities, through bursaries, scholarships, fellowships and awards from institutions that offer these. And as a student or newly registered nurse, it might be something that you want to ask at interview when you're comparing which areas that you're going to go and work in, because some specialist areas will have modules aligned to that clinical environment. So if you go and work in ICU or in renal, for example, or in some mental health areas, learning disability children, it's across the fields. They may have places for 15 nurses to apply for post-registration master's modules. And so you're not funding those courses, and your employer will have secured the funding every year. So do check out what's available when you're looking at roles. I have a video how to get funding for post-registration nursing courses with a bit more detail if you're looking at charitable funding or clinical academic internships, for example. That's quite helpful as well. Second tip: how much time will it take to complete? So you need to check on the university websites or on the module handbooks or program handbooks. And can you come out of practice from your clinical role on certain days to attend courses if there's face-to-face, or if there's virtual courses and there's a percentage of attendance, for example? Or are you looking more at a blended learning type approach or a virtual online approach where you don't have to attend classes, that it's very much self-directed? You might have to attend assignments, so the assessments might be presentations or simulated OSCE skills assessments. So finding out how much time you need to complete the course is important, because then you need to apply for study leave, or you might need to apply for certain days off or annual leave days. And it's not a given that managers will allow you to attend courses if they can't replace you in the clinical area, because their priority is service delivery. So it's really helpful to check that out before you go and sign yourself up for a course and then find that you can't actually attend the course. So my final third tip is: how does this course or module align with my career goals and my aspirations? And it's very important that you ensure that you're on the right module or the course, because what you don't want to have to do, which I know people this has happened to, they've actually done a course or a module that wasn't the correct one for applying for a certain job or for the career pathway that they're aspiring to. And if you're not paying for a course, you might think, well, you know, it doesn't really matter, but it's a lot of effort doing courses while you're working, often full time. So careers obviously are fluid. You can go across career pathways. So if you did a leadership course at master's, a postgraduate leadership course, you know, that's transferable to most career pathways. But some careers and some roles require certain modules and certain masters. So it's looking at those job descriptions and getting some career advice. So talking to career advisors, educators, and people that are actually in the roles that you're aspiring to, so that you're not making a mistake and applying for the wrong course or the wrong module. I do have some helpful videos on some simple videos, practical advice on career pathways such as charge nurse, nursing sister or senior nurse, for different educator roles, for different research nurse roles and clinical academic posts. And for specialist nurse or advanced nurse practitioner career pathways. And in those videos I talk about the education that would align to those roles. The video on 4 pillars of advanced practice is also very helpful, and 5 top tips to increase your chances of securing funding for courses. Sometimes, even if a course is being offered in your clinical area, you might have to have an interview, for example. But if you're looking at clinical academic internships or charitable funding, that will be competitive. So there's some good tips in that talk as well. So I hope you found this helpful. If you've got any questions at all, I'll answer in the YouTube comments, or you might prefer to contact me one-to-one privately. DM me on Twitter or Instagram or on my website. So good luck with any future applications and your career journeys.